Good morning, Facebook Live and Joslyn fans. I'm Rebecca, the program director here at the Joslyn Center, and this is episode 96 of the Joslyn Variety Show. 97? We're really getting up there, guys. And today is Wednesday, so we are going to do Brain Health with Susan today. But first, we will do our stretches and our warm-up with Veronica. And don't forget, this afternoon is Tech Untangled. That will be at 2 o'clock on Zoom. So if you haven't used Zoom yet, or if you would like a little one-on-one tutorial, then I would be happy to get you set up before 2 o'clock today. And then you can join us for that. Tomorrow morning at 9 a.m. is our Zoom chat group, and that one is just a social group to kind of chat, get to know each other, make some friends. And then of course we'll be back with the Joslyn Variety Show tomorrow and Friday as well. All right, so if you're ready, we have Veronica here to do our morning workout, and then Susan for some brain health.
Thank you, Rebecca. Morning, everyone. Okay, let's get moving. And if you're seated, just get your knees up marching. If you're standing, get your arms swinging. We'll get ourselves warmed up and do a few stretches before Susan's program. Okay. Let's do some stepping side to side. Step side to side. Comfortable, make it a wide step. Make sure that you keep breathing. While you're thinking about what you're doing, don't hold your breath. Keep breathing. Let's move our arms. Let's bring our arms up, up, and keep your shoulders down while you're doing this. So you're raising your arms, but not your shoulders. Okay, let's bring the hands overhead so we can step up, step down. Hands go up, your shoulders stay down, your arms go up. Good. You're doing a little stretching while you're reaching your arms up. I'm using it right now as part of our warm-up. Okay. Oh, okay. All right, so now we're just doing our hamstring kicks. So keep your feet wide, kick up your hamstrings, kick and kick. So I'm not using a chair for balance. If balance is a concern, make sure you just always have your chair right there. You can even have your chair in front of you. Okay, so now I'm going to stand, feet hip width apart, and just do a little kick, kick. So alternate your kicks. You're not kicking high, so keep your torso upright straight, and just kick out, kick out. Good. All right, now let's do some stretches that for the inner thighs. We haven't done these before. So widen your step, and we're going to stretch to the side. As we do that, think about sort of reaching back with your glutes, like you're going to sit down over here. So reach back with your glutes. Now what this does, we're stretching the inner thighs. Nice stretch here. We're also keeping our knee behind our toe there. Okay, so that's why I'm saying reach back, almost enough to throw yourself back. And just sit there in that stretch. Keep your inhaling and exhaling continuing. Good stretch for the inner thigh, and now the other side. So you're going to kind of sit back a little bit as you go to the side and feel that stretch there. Your feet are pretty much, they're pointing forward. Okay, and let's go back to the first side. We'll do this a couple times. So this is one of the stretches you can do on your legs. We often do the stretch for our hamstrings by bending forward. Just going side to side and get our outer thighs there too. The stretch we did last week seated with our leg across, and we're seated like that. That goes nicely right down the outside of the thigh. So remember that stretch, that's important. Okay, let's do our stretch up for your sides here. Your obliques, reach up, shoulders stay down, reach up and over. Again, your feet are a little wider than hips, and let's swing back and forth. So you're really relaxing. You're nice and stable down here, and just let yourself relax. Breathing in and out slowly and deeply. That's good. Okay, we have to finish with our shoulder rotations. And just relax. You've got a lot of very good information coming your way in just a moment. Okay, enjoy the program and enjoy your day.
Thank you, Veronica. All right, let's get Susan all situated. I'm gonna take you guys a little closer so you can see her.
You can't tell I'm smiling. I have to leave my mask on.
How-
You got 6 feet away. Are you guys all doing that? Are you tired of it? Are you buying designer masks, a few different masks?
All right.
So, okay, hello everyone. So today is a lot of information and I think you'll enjoy it. So I'm Susan Chinsky and I teach Problem Solving Solutions, which is a program that you come in and we discuss what's going on and try to find some solutions for you. And right now, a lot of people are trying to redesign their life. What does it mean to live under a pandemic and live at home and do a lot of stuff at home? Hopefully everyone has Zoom, you're doing Facebook. Hopefully you're doing lots of different things at home. So that's one of the things I do. I also teach Brain Boot Camp. And we have a class that's starting next Wednesday from 1 to 3, and it'll be a 2-week class. And we teach all about the brain. It's a program from UCLA. So if you are interested, call the Wellness Center, talk to Veronica. She can sign you up, and we'd be happy to see you. So one of the questions I get the most in Brain Boot Camp is, can you guess? Can you guess why people come to Brain Boot Camp? What are they thinking about? It's dementia and Alzheimer's. They are afraid they might get it. And do you know what the difference is between the two of them? Most people don't. So I've sent out papers that I really wasn't too happy with, and I thought, let me do some research. So I did some research, and that's what we're going to talk about. What is the difference? And a lot of the stuff I got was from Dale Brezen, The End of Alzheimer's. This is his book. I really like him. I think he has a lot of good information. So to begin with, what is it? Well, dementia is the umbrella of it. And it's the global cognitive decline of mental abilities. So everything goes into the umbrella of dementia. So if you think about that. And there's 6 different types of dementia, and one of them is Alzheimer's. So we'll talk about that. But dementia is memory loss that often more of the symptoms could be difficult reading, writing, speaking, following conversation, reasoning, calculating, organizing, and planning. So you basically just have some problems doing things in your life. Now there's types of dementia. I said there were 6. One is vascular dementia, and we'll talk about all these individually. Frontal temporal dementia, Lewy body dementia, Alzheimer's disease, subjective cognitive impairment, and mild cognitive impairment. So the first one, vascular dementia. Vascular, if you know, usually has to do with blood flow. So it's the blood flow to the brain that's marked by strokes. And Alzheimer's disease and vascular dementia sometimes overlap. So sometimes it's really hard to figure out which is which. Now, frontal dementia is much less common than Alzheimer's, and its features are changes in the behavior, mental problems, and difficult speaking. It kind of sounds like I have it right now, but I don't. Don't worry, I'm good. So, Lewy body dementia is, and it's a fairly common cause of dementia. Now, 1 patient for every 5 Alzheimer's patients has Lewy body dementia. And that's more visual hallucinations, delusions, increased sleeping, fidgeting of limbs during sleep. So if you're sleeping and you have REM sleep, you're moving your body more, and that's part of Lewy body dementia. So body's in the name, so it's about the body. Now, the next one is Alzheimer's disease. So that's marked by amyloid plaque and tangles in the brain. It's also can be seen in PET scans as well as cerebral spinal fluid. They can look at the fluid and actually see it in there. Alzheimer's disease is diagnosed based on patient symptoms, which memory loss and cognitive decline are severe and ever present. And it can lead to the problems of people having to bathe, eat, or dress without assistance, and is increasingly unable to care for him or herself. So a lot of times we think of Alzheimer's, and I think it's really worth thinking about the beginning stages of Alzheimer's, which we're going to go through, which is subjective cognitive impairment. Now this is the worsening cognition that is noticeable usually by the individual, and it falls into the normal range if you go to the doctor. But sometimes you think, oh, I keep forgetting things, I misplace things. That can just be subjective cognitive impairment. PET scans and cerebral fluid also shows that there's a problem, and also you may have shrinkage in the brain. It's often a decade or so that you progress to mild cognitive impairment. So the first one would be subjective impairment, you're feeling. The next one is mild cognitive impairment. So that is typically followed by subjective cognitive impairment, and you can show it on memory tests. Also, organizing, speaking, calculating, planning, and other cognitive abilities are abnormal, but the person is still able to perform actions of the daily living, such as dressing, eating. It also does not inevitably go to Alzheimer's, but many people will get Alzheimer's later on. So it's a progression of things. Not all of a sudden people are diagnosed with Alzheimer's. Usually there's stages, and these are some of the stages that you can go through. Now, the brain is really just responding to certain threats in the environment. So sometimes a lot of toxins are coming in. They're chronic, you have multiple problems, they're intense problems. So these are all coming into your brain and causing damage. But can Alzheimer's disease and cognitive decline be reversed? And if so, how? So it can be, because just like you get insults to the brain, you can also do things to take away those insults. And how you do it, there's 3 metabolic and toxic threats to the brain. So one of them is inflammation. And inflammation can be from diet, infection, and other causes. But if you have a chronic infection, you really want to look at it. Is it causing other problems? Also, decline and shortage of supportive nutrients, hormones, and other brain healthy food. So are you getting the right nutrients every day? Are you eating well? Are you eating better fats than the toxic fats? Are you eating brain food that we talked about? You know, the omega-3s, we talked about the walnuts, we talked about the antioxidants, the fruit, vegetables. So are you getting all those? Because those will help the chronic problems, the insults that you may be injuring to your brain. So, and also toxic substances such as poisons and produced by mold. You know, are you breathing pesticides? Do you have mold in your environment? Are you doing too many chemicals that you're spraying with now? So all these things can damage the brain. So you want to look at like everything. So Dale Breslin believes that there's about 40 required effective prevention and early reversal things, that there's about 40 of them that can contribute to cognitive decline. So how can we reverse cognitive decline? That's the important thing. So it's necessary to remove those factors causing the brain to defend themselves by producing the amyloid. So we need to do some things. We remove the amyloid itself, and then we rebuild the synapses that the disease has destroyed. And how do we do it? We talked about brain games, we talked about learning, education, doing all sorts of things to help your brain. So all these things can help your brain so you don't have to get cognitive decline, you don't have to get Alzheimer's, you can keep your brain healthy and good. So again, I'm Susan Chinsky at Joslyn Wellness Center, and if you want, you can call me and we can talk more about your brain or talk about one-on-one problems that you may be having right now. So thank you, and back to Rebecca.
Thank you, Susan. All right, folks, that is our Wednesday variety show, but I hope we will see you later today for Tech Untangled, and then back again tomorrow for Zoom chat group and another episode of the Joslyn Variety Show. And of course, we are always here for you if you have more questions about anything that Susan has talked about today, or if you are looking for resources or support or anything like that, give us a call. We're here to help. 760-340-3220. Thank you and have a great day.